Yelets is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks of the body. It is important to take Yelets as directed by your healthcare provider. The recommended daily dosage may vary depending on your specific needs. It is best to take Yelets at the same time each day to help you remember. It is also recommended to take it with food to help with absorption. Be sure to talk to your doctor about the best time for you to take Yelets and the benefits it can provide for your health. When taking Yelets, it is usually recommended to take it once a day or as directed by your doctor. It is best to take this medication on an empty stomach, at least 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you can take Yelets with food. However, it's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. After taking the tablets or capsules, make sure not to lie down for at least 10 minutes. If you are taking the delayed release form or extended release capsules, be sure to swallow them whole and do not crush or chew them. Take Yelets regularly at the same time each day to get the most benefit from it. If you experience constipation, diarrhea, or an upset stomach while taking Yelets, don't worry. These effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, contact your doctor or pharmacist. Taking Yelets may cause your stools to turn black, but this is a harmless effect. If your doctor has prescribed Yelets for you, it's because they believe that the benefits outweigh the potential side effects. Many people who take this medication do not experience any serious side effects. A severe allergic reaction to Yelets is rare, but if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, it's important to follow your doctor's recommendations when taking Yelets. If you have any concerns about the medication, don't hesitate to reach out to your healthcare provider. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It's important to keep Yelets out of reach of children, as accidental overdose of iron-containing products can be fatal in young children. If overdose does occur, seek medical help immediately or contact a poison control center. Remember to always store medications in a safe place to prevent accidental ingestion by children. Before taking Yelets, it's important to talk to your doctor or pharmacist about any allergies you may have to its ingredients, as well as any medical history you have, such as iron overload disorder, alcohol use, liver problems, or stomach/intestinal problems. If the brand of Yelets you're taking contains folic acid, be sure to let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. If you are pregnant or breastfeeding, it's important to consult with your doctor before using Yelets. And before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that Yelets may interact with other medications you may be taking. This can affect how those medications work, and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's essential to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Yelets can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of Yelets. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to be aware that Yelets may interfere with certain lab tests, which could potentially cause false test results. Make sure that the lab personnel and all your doctors are aware that you use this medication. If you or someone you know has taken too much Yelets and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember, it's always better to be safe and seek help if you have any concerns about taking Yelets. If your doctor has prescribed Yelets, do not share it with others. It's important to keep all medical and lab appointments while taking Yelets. Some brands of Yelets may also contain ingredients such as docusate. If you have questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. Remember that Yelets is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take your Yelets at the scheduled time, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose. Take the next dose at your regular time and do not take extra to make up for the missed one. When storing Yelets, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's not the bathroom, and also to keep it out of reach of children and pets. When it comes to getting rid of Yelets, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, make sure to properly throw it away when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.